Welcome to Heal Mind, your ultimate destination for mental clarity, emotional balance, physical strength, and holistic healing. Need focus? Want energy? Craving inner peace? Subscribe now and unlock daily tools to transform your mind, body, and spirit. What you get: expert tips on psychology, nutrition, and mindfulness-guided meditations and deep healing frequencies. Powerful advice on mental strength, anxiety relief, and spiritual growth. Join a global movement of healing, empowerment, and wellness. Like, share, subscribe, and hit the bell so you never miss a moment of healing. Drop a comment to tell us your biggest wellness goal. We're here for you. Heal Mind Plus, your daily source for calm, clarity, and total well-being. Subscribe now and begin your journey to a healthier you. This information reflects the evolved understanding of Mpox following the global outbreak and anticipates the focus of public health and research into 2025. Definition: Mpox is an infectious viral disease caused by the monkeypox virus MPXV, a member of the Orthopoxvirus genus, which also includes the variola virus causes smallpox and vaccinia virus used in the smallpox vaccine. Historically, Mpox was a zoonotic disease largely confined to Central and West Africa. However, the 2020 global outbreak established new patterns of human-to-human transmission, leading the World Health Organization (WHO) to officially rename it Mpox to reduce stigma. It is now considered a globally relevant infectious disease. Anticipated 2025 status: by 2025, Mpox is expected to be treated as an endemic virus in many more countries outside of Africa. Public health strategies will have fully shifted from emergency response to long-term management, surveillance, and prevention, similar to other sexually transmitted infections (STIs). Signs and symptoms: the presentation of Mpox can vary significantly between individuals. While there is a classic presentation, the recent outbreak highlighted many atypical cases. Classic stages: incubation period 3-17 days, the time from exposure to the first symptom, during which the person is not contagious. Prodromal stage 1, 5 days, characterized by initial, nonspecific flu-like symptoms, fever and chills, swollen lymph nodes, lymphadenopathy. Key feature that helps distinguish Mpox from chickenpox or smallpox. Glands in the neck, armpits, or groin may become tender and swollen. Intense headache, muscle aches, myalgia, and back pain. Profound exhaustion, asthenia. Rash stage 1 to 3 days after fever. The rash is the most identifiable feature. Progression: it evolves through distinct stages. Macules, flat spots, gives papules, raised bumps, gives vesicles, fluid-filled blisters, gives pustules, pus-filled blisters, gives scabs, crusts that eventually fall off. Location: can appear anywhere on the body, including the face, palms of the hands, soles of the feet, chest, and back. The 2022 outbreak saw a high prevalence of lesions in the genital, perineal, and perianal areas, as well as inside the mouth and rectum. Atypical presentations: many recent cases presented with a single or very few lesions, a rash appearing before the fever, or no preceding flu-like symptoms at all. Anticipated 2025 update: research will likely provide a clearer understanding of the full spectrum of Mpox, including the frequency and transmissibility of asymptomatic or pre-symptomatic infections. This will be crucial for refining public health guidance on testing and prevention. Diagnosis: accurate diagnosis is critical for treatment and preventing further spread. Gold standard: current and 2025 PCR test, the most reliable method. A healthcare provider collects a specimen by vigorously swabbing a lesion, preferably from an open or unroofed pustule. The sample is then analyzed using a polymerase chain reaction PCR test to detect the virus's genetic material DNA. Other diagnostic considerations: differential diagnosis. A provider will rule out other conditions with similar rashes, such as chickenpox, herpes, syphilis, and allergic reactions. Blood tests: generally not used for diagnosing an active infection, but can be used in serology studies to detect past exposure. Anticipated 2025 update: the development and approval of rapid, point-of-care diagnostic tests similar to rapid antigen tests for COVID-19 will be a major focus. If successful, these would allow for immediate diagnosis in clinics or at home, enabling faster isolation and treatment. Most Mpox cases are mild and resolve on their own within 2 to 4 weeks. Treatment focuses on managing symptoms and preventing complications. 1. Supportive care primary approach. Pain and fever management. Over-the-counter medications like acetaminophen, Tylenol, or ibuprofen, Advil. For severe pain from lesions, prescription pain relief may be necessary. Oral and analgesic care, medicated mouthwashes for oral lesions, and sitz baths for genital, anal lesions can soothe pain and promote hygiene. Preventing secondary infections, keeping lesions clean and dry is crucial. Avoid scratching and cover lesions with light bandages or clothing to protect them. 2. Antiviral medication, Tecovirimat TPOXX. This is the primary antiviral used for Mpox. It is recommended for people with severe disease, those at high risk of severe disease, for example, immunocompromised individuals, pregnant people, young children, or those with lesions in dangerous locations, for example, eyes, mouth, rectum. Anticipated 2025 update. By 2025, robust clinical trial data will have provided clearer guidelines on the efficacy and optimal use of Tecovirimat. We can also expect more data on other potential antivirals like brincidofovir. Access to TPOXX will likely be more streamlined and widespread. Home remedies and self-care. If isolating at home, the focus is on comfort, hygiene, and preventing transmission. Strict isolation. Remain isolated until all scabs have fallen off and a new layer of intact skin has formed. This includes avoiding close contact with all household members and pets. Lesion care. Take warm baths with colloidal oatmeal or Epsom salts to soothe itching and clean the skin. Gently pat dry. Do not rub. Hydration and nutrition. Drink plenty of fluids and eat a nutritious diet to support your immune system. Mental health. Isolation and the stigma of the disease can be mentally taxing. Stay connected with friends and family via phone or video calls. Seek mental health support if needed. Environmental cleaning. Use standard household disinfectants to clean surfaces and handle laundry, bedding, towels, clothes carefully without shaking it to avoid dispersing infectious particles. Prevention. A key 2025 focus. Prevention strategies have evolved from reactive to proactive. 1. Behavioral prevention. Avoiding close, skin-to-skin contact with someone who has an Mpox rash. Reducing the number of sexual partners during periods of high community transmission. Using condoms can help, but they do not prevent all exposure since the rash can be on other parts of the body. 2. Vaccination. Vaccine. The primary vaccine used is JYNNEOS, also known as Imvanex or Imvamune, a 2-dose vaccine. Post-exposure prophylaxis (PEP). Administering the vaccine after a known exposure to prevent illness or reduce its severity. Pre-exposure prophylaxis (PrEP). Administering the vaccine before exposure to those at high risk. Anticipated 2025 update. Widespread PrEP. Mpox vaccination will be routinely offered as PrEP to established high-risk groups, integrated into sexual health clinics alongside HIV PrEP and STI testing. Refined vaccine strategy. Research will likely clarify the duration of immunity from the JYNNEOS vaccine and whether booster shots are needed. Studies on single-dose effectiveness will inform more flexible public health campaigns. Global equity. A major global health goal will be ensuring equitable access to vaccines and treatments to prevent Mpox from becoming permanently entrenched in newly affected countries. Disclaimer. This information includes projections based on current trends. For the most accurate and up-to-date guidance, always consult official health organizations like the WHO and your local public health authority.